this is Pam. I just wanted to say sorry we're a few minutes late today for Tuesday Tips. Gotta love that technology. So welcome to another Tuesday Tips. My name is Pam Dunwald. I'm one of the two nurses in our company, Your Nurse Advocate Consulting. So this month of September is Healthy Aging Month. And so oftentimes we get asked, what can I do to help support my aging parents or grandparents or aging loved ones? And for healthy aging, one of the things that we like to talk about is having that, what can we do to help build that support system? So that's what today's Tuesday Tips is going to be about, is how can we foster a support system for our aging family members to help them travel those golden years the way that we all imagine the golden years are supposed to be. Oh, this is the time where we travel and do things and hang out with friends and all these different wonderful things that we envision, or that the media has told us our golden years are supposed to be. So what can we do to be proactive to try and make those golden years experience as best that we can? So let's go ahead and jump into that. So building support system is essential for healthy aging. It provides a foundation of love, support, encouragement, camaraderie, just relationships, people that are, with them at their same age. And so we're going to talk about what some of those ways that we can do to help foster that. And I know I've said this before, but as our aging parents and aging loved ones continue to age and get older, their circle of friendship, their circle, their social circle, friends, family, neighbors, just acquaintances, work people that they've worked with, though that circle begins to get smaller and smaller and smaller. So what happens when that circle gets smaller? Then they start to have feelings of isolation, loss of purpose. They can develop signs of depression. This is where, and in the hierarchy of needs, are the developmental needs of our elders, 65 and above, is really the challenge for their age group, is to maintain that purpose. So anything that we can do to foster them being active, a great way would be to be active in the community, a volunteer. I mean, all of our loved ones have developed, skills throughout their lifetime. And so our elders are no different. They've had years and years and years of all kinds of different experiences. So having them volunteer, depending on what their choices or what their background, their skills are, I mean, that's a way for them to have that and build that sense of purpose, giving back to the community, being part of something bigger than themselves. And that is a big way that they can, develop, purpose. So Healthy Aging Month is a time to focus on the positive aspects of aging. And that's why we chose this topic for this week. This is our second week of celebrating Healthy Aging Month. And why we chose the support system as a topic is because it's something that we can be proactive. It's something that we can work on while their health is good, and this is one of those areas that will help them coast through those golden years and have it to be a pleasurable and a memorable experience. So some of the challenges that seniors face, as we talked about, was isolation, physical limitations. So sometimes, their lack of participation is not by their choice. I mean, it's by what their body is limiting them to be able to do. So as families of aging adults, that's one of the things that you can do to help support them, is to offer that transportation or offer ways of being able to keep their activities going. Maybe it's hard for them to get out. I'll give you a great example. We had an elderly couple in our town here, and they were both wheelchair bound. One was a bilateral amputee. Both legs were amputated. Both were in a wheelchair, and they were extremely isolated. So one of the members, that a neighbor of theirs, and also someone we know from church, they decided to start a card club. They couldn't go anywhere, but there was other people that could go to them. So this card club went on every day. Not all of the same people were there every day, but every day, Monday through Friday, for a good part of the afternoon, they had card club at their house, and they had aid services. They had, help in the home to meet their needs, but it was fun for them. The aides would prepare some food, and they really made the best of a bad situation, and it really helped to keep them in a good mood, and they had something to look forward to every day. So it doesn't have to be anything elaborate. We just have to think outside the box, but knowing that these types of things are really going to improve the quality of their life. So we talked about some of the ways to build a support system. Uh, Staying connected with family and friends is huge. I've mentioned this before too. Sometimes we do as a family, since we're all spread out from Alaska to Ohio to Wisconsin, just everywhere, Illinois, we get family Zooms. And so maybe your loved one isn't that, technology technology savvy. Let me spit that out. But maybe you can bring the technology to them. Maybe you could use your cell phone as your internet, and you can get on a Zoom and you can let them visit and talk with people that maybe they can't get out to see. You know, there's nothing that brightens up a senior's life more is to see family members and grandkids and great grandkids. And so it's one thing to talk to them on the phone, but we have this amazing technology that allows us to be able to see each other's faces and expressions and laugh together and talk to more than one person at the same time. So find a way that, maybe once a month or once every couple of weeks, or, something that we can do to help them feel that they're connected, to friends and family. Social groups, if they can get out or use public transportation, or if there's maybe a church group or someone, a volunteer that maybe could provide some transportation, get them to a senior center. Senior centers are amazing place. Again, they'll be with people of their own age, people that understand their generation, people that they can talk and relate to. And so that would be another great idea. And sometimes, professional groups, whether it's a grief group, if they've had a loss and they seem to be struggling and wanting to isolate themselves. I know my mother-in-law, when she lost my father-in-law, she really isolated herself for a year, but she did one of the things that she would do, she'd go out and do her grocery shopping, but she joined through the hospice. She joined a grief group, and that really brought her out of that deep darkness of loss and grief. And so it was, and we would talk to her, and with me being a nurse, we've got other healthcare providers and, in the family. And she just didn't feel that we understood. And she said what she got most out of the grief group is the fact that and this group happened to be all women, doesn't always be all women, but she said she was with a group of women. They laughed together, they cried together, and each one of them lost their spouse, and they all could relate. So there was such a strong bond that was made between these women, and they were doing lunch outside of the grief group. And so that really became a support system for them at a time when, family, we weren't not the most effective, support for her. So try and look at things that we can do. And maybe sometimes we do need to seek out professionals. We talked about joining a senior center. We talked about volunteering. We talked about connecting with family and friends through phone calls, video chats, or in-person visits. So I think we have spent a fair amount of time on those things. So what exactly are the benefits of a support system? Well, seniors, that increases their immune system and improves their health, lower risk of depression. And so lots of good reasons, to build that support system now before, it becomes something that you wished you would have had in place. One last thing I want to say is when you're looking at a support group, maybe think about, a nurse advocate or a health advocate that could come alongside you and be part of that support system. We're super excited. We're getting ready to roll out our revamped, it's kind of our our support system. It's it's going to be a monthly fee, but with that monthly cost, you're going to be able to be part of an elite community where you will have Linda and myself essentially in your back pocket. We will be having, insider information for those that are a part of this group. And we are also going to allow you to have one-on-one time with us, that it's included, that if something comes up, maybe everything's going fine now, but 2 weeks from now, things start to fall apart, you can, reach out to us and we will schedule that one-on-one time with you. So we're really, really super excited about having this really good, affordable way that as nurse advocates, we can be part of that support system. So we're going to be excited to share that in the near future. And, thanks for joining us. Thanks for recognizing the importance of building a strong support system. So just the fact that you watch this either live or in the video is a testament to your dedication to your loved one, and you wanting the best. And again, that's what we want. We want to help you help them get the best care and have the best experience through their golden years as possible. So with that being said, we would like to say goodnight, and we will see you next week for Tuesday Tips. Have a great week. We'll see you soon.